Dr. Dunn, you recognized for 5 minutes.
Thank you, Mr. Chairman, and thank you also, Secretary Shulkin, and all of you gentlemen for spending your evening with us. I'm sure that it's exciting for you to be here. I also want to thank Secretary Shulkin for mentioning Dr. Tom Starzl, who passed away this last weekend. He was a champion for veterans, a champion for and a pioneer in the transplant surgery realm, and I was fortunate to study under him many years ago. Mr. Secretary, just yesterday, a veteran I represent provided to my office an account of his experience receiving specialty care through the CHOICE program, and it underscored a number of the challenges we've discussed here today. In particular, the veteran encountered poor communication between the VA and the third-party administrator, and also between the VA and his CHOICE provider, and it severely delayed his access to care. And although he ultimately did get an appointment with a podiatrist through the CHOICE program, the nearest provider was hours and hours away from his home, and he had some difficulty getting his prescribed custom prostheses and orthotics, and ultimately he did the math on the round trip, multiple round trips to these things, and the prosthesis was cheaper, and the medical care was cheaper out of his pocket. Yeah. And that's what he did. This letter is actually, it's an amazingly lucid and articulate and polite letter. And I will make that available to the committee because it reads like a Marx Brothers skit. I won't bother you with it now, though. My question to you, Mr. Secretary, is what should this committee keep in mind in regard to the particular needs of the specialty care patients like this? And how is that different from the primary referrals? This is sort of a special situation.
Yeah. Well, what we are doing to make sure that we get this right is we are doing community by community assessments, because there's, just like real estate, all healthcare is local. And so there are some areas that have oversupply of specialists and some undersupply. And it sounds like your constituent lives in an area where there might be a shortage of specialists in some of those areas.
Yeah, on your panel, clearly. And I know there are specialists near him, but for whatever reason, they're not on the panel. Yeah, yeah.
We are continuing to grow our network. So if there are available specialists in the area and we have a shortage of them, we are continuing to grow that area. We actually have a slide of this where you can see the progress that we're making in provider growth right now. It might not pop up. Oh, there it is, 133% growth. But we need to continue to build out the network, and stories like that are impactful, so I'm glad you're going to make it part of the record, and we can look at that.
So I'm also, my practice, we were on your CHOICE network, and I will say that that a lot of times the problem was not that the veterans are there in town, we're there in town, we have slots for them, we can see them, but the problem was authorizations. I mean, the system in a number of ways is dysfunctional. Mr. Paulkin mentioned the payment system is just also pretty dysfunctional, but more basically, it's important to get them in, get them taken care of. And they had to go back for authorizations again and again and again just to see the same doctor about the same problem. What are we going to do to make that system work a little better?
Well, when we started, our authorizations were only good for 60 days. We did a contract modification. We made it for a year. And so as we learn the problems in the program, much like the way that you're describing, we are doing these modifications. Had 70 of them since the contract started. So
they would come to see me, and they wouldn't be able to get x-rays. I mean, I could see them, I could prescribe a medicine which they'd have to go get at the VA, but they couldn't get the x-rays, and I couldn't see the x-rays. The delays were just atrocious.
Yeah, in addition to lengthening the episode's care, what we're doing now is doing bundles. And so, if you're getting your hip replaced, the PT comes with it, the x-ray comes with it, the MRI comes with it. So we are trying to tackle that problem as an episode together, so we don't split up and we maintain continuity of care.
Thank you. We look forward to working with you. We're all excited about the possibility. Thank you, Mr. Chairman. I yield back.
Thank you, Dr. Dunn. Mr. Sablon, you recognized.